Question number 146. Amount of blood pumped by both ventricles per cardiac cycle is. And the options given are 70 ml, 140 ml, 5040 ml and 72 ml. Amount of blood pumped by each ventricle in a cardiac cycle is known as stroke volume, and stroke volume is 70 ml. As we have to give answer according to both ventricles. Amount of blood pumped by each ventricle is 70 ml. So amount of blood pumped by both ventricles will be equals to 140 ml. So correct answer to this question is option number 2. Let's move on to the next question. Question number 147. Choose the incorrect feature with respect to normal exhalation. And the options given are, first option, diaphragm relaxes. This is correct. Second option, elastic recoiling of lungs. This is also correct. Third option, external intercostal muscles relax. This is also correct. Fourth option, intrapleural pressure becomes more negative. This is incorrect. Intrapleural pressure becomes more negative during inhalation, not exhalation. So correct answer to this question is option number 4. Let's proceed to the next question. Question number 148. Left shift of oxyhemoglobin dissociation curve occurs due to. The graph between partial pressure of oxygen in mm of Hg and percentage saturation of hemoglobin with oxygen is sigmoid in shape, and if graph shifts to right side, this indicates dissociation of oxyhemoglobin. And if this graph shifts to left side, this indicates hemoglobin is more saturated with oxygen. The primary factors which affects the formation of oxyhemoglobin is partial pressure of oxygen. When partial pressure of oxygen is more, then this curve will shift to left side. And when partial pressure of CO2 is less, then also curve shifts to left side. And other factors are, when PCO2 decreases, H plus ions concentration also decreases. When H plus ion concentration decreases, then pH increases. And other factor is temperature. When temperature decreases, then shift to left occurs, and when BPG decreases, then also shift to left occurs. These are the factors which are responsible for shift to left. Now let's see the options. Option number 1, high temperature and high pH. This is incorrect because high temperature is responsible for shift to right. Second option, low temperature and high pH. This is correct. Option number 3, low pH and high temperature. This is incorrect because these factors are responsible for shift to right. Fourth option, low pH and low temperature. Low pH, this factor is responsible for shift to right. So this is also an incorrect option. So correct option to this question is option number 2. Let's move on to the next question. Question number 149. Choose the incorrect statement with respect to regulation of respiration in humans, and the options given are: first option, respiratory rhythm center located in medulla can cause either expiration or inspiration according to neurons which are activated. This is the correct statement. Respiratory rhythm center is present in medulla oblongata, and in this center, two group of neurons are present, dorsal group of neurons and ventral group of neurons, and they can cause either expiration or inspiration according to neurons which are activated. Option number 2, signals from pneumotaxic area located in pons results in slow and deeper breathing by increasing the duration of inspiration. This is incorrect because pneumotaxic center inhibits dorsal group of neurons in respiratory rhythm center, duration of inspiration decreases so there is partial filling of lungs. As a result, duration of expiration also decreases, and finally rate of breathing increases. So when signals from pneumotaxic area comes, rate of breathing increases and shallow breathing occurs because you can see partial filling of lungs occurs. So this is an incorrect statement. Option number 3, aortic bodies located in aortic arch have chemoreceptors sensitive to CO2 and H plus ions. This is correct. Option number 4, chemosensitive area is located adjacent to rhythm center in brain and plays role in altering the rate of respiration. This is also a correct statement. So incorrect statement is option 2 and correct answer to this question is option number 2. Let's move on to the next question. Question number 150. In the given chart, choose the option that correctly represents the blanks marked as A, B, C, D and E. Leukocytes, they are of two types, granulocytes and agranulocytes. In granulocytes, neutrophils, eosinophils and basophils come. So A and B are neutrophils and basophils. Agranulocytes include lymphocytes and monocytes. So C should be monocytes. Lymphocytes are of two types, B and T lymphocytes. So correct answer to this question is A, neutrophil, C, monocyte, E, T lymphocytes. Option number 3.